There are numerous things you need to keep an eye on before you can select a particular modality for treatment. You need to focus on the benefits, therapeutic benefits or therapeutic effects of that particular modality, and you need to also keep an eye on some of the contraindications before you can start using a particular modality, or else you're going to cause more harm than good afterwards. Let me give you a particular scenario. There was this patient who came to a physiotherapy unit with low back pain. The patient was febrile patient, so some assessment was done and the therapist decided to go by infrared radiation heat therapy. So the treatment was commenced, and later after the treatment session, the patient started bleeding unstoppably. It was very severe, so the scene became very serious and disturbing, and so there wasn't any other option than to rush the patient to the emergency unit for immediate first aid to be commenced. So in the course of conversation with the patient, once again by the in charge, then the patient mentioned that she is in her menstrual period. Wow. It kept a lot of people talking because they regarded that act from the therapist as potential negligence act. This should be something that you don't have to become a victim of. That is why certainly gathering thorough patient history is the best to be able to decide on proper treatment approach at the clinical settings. In this video, I'm going to be talking about some dangers associated with application of infrared radiation, and I will end by introducing you to some contraindications you need to note so that you don't get yourself into some of this mess one day. Stay tuned, I'll be back.
They'll go with a 4-4-2 diamond formation for that early lead.
An early goal will settle the nerves.
Their away team has been in bad form. They will feel the pressure.
The home side's kept 2 clean sheets in a row.
It's all about momentum.
Who will have the stamina to last the 90 minutes?
Their star striker is suspended.
They've got no kappa.
The marking will be tight.
This will be won or lost in the midfield.
This is why I bet.
This is why I bet.
This is why I bet. Betway, for the love of the game.
Alright, so let's get started. Let's get to the dangers associated with infrared radiation application. You are welcome to the show. Now I'll be introducing you to these dangers, but you have reasons to why some of these dangers are likely to happen projected on the screen for you. So the first danger is burns. You have the reason there, as you can see, and the second one is skin irritation. That is the reason projected there. The third one is dehydration. It has a reason for that. And then the fourth one is low BP, low blood pressure. The reason is also projected there. The fifth one is defective arterial blood flow, which is also having its reason being projected there. And the sixth one is eye damage. So these are dangers you need to take note of whenever you are using infrared radiation. Now let's then move on to the contraindications in the next scene. Alright, so now let's get to the contraindication. As the name implies, contraindication has to do with some conditions that you need not to use the infrared radiation, because when you use, you are going to cause more harmful effects to the patient than good effects. And so the first on the list is impaired cutaneous thermal sensation. So this is trying to say that if the patient doesn't have sensation for heat, then you don't have to use the apparatus because you can cause burns where the patient will not be able to distinguish whether there is so much intensity or there is low intensity.
This be lovely Asantewa. Her customers like Hamwa. I did for you. She be 24/7 business madam, always on the move. I did for you. Hey ho, but this be cool chop crack. I be Royal King Cracker, made with real milk butter and the goodness of wheat to keep you going. Let's do it. No dull moment. All you busy bees, I did for you. Introducing onion and parsley, the spicy new addition to the King Cracker family.
Let me remind you that we are still talking about contraindications, and I initially introduced you to one of them, which is impaired cutaneous thermal sensation. Now the second on the list is defective arterial cutaneous blood flow or blood circulation. If you have problem with the arteries on the superficial surface of the skin, you don't have to go ahead using heat, because heat is going to cause vasodilation, and already know that the vessel is having problem, which can result to rupture, and it can worsen the person's condition. The third one is dermatitis, commonly known as eczema. So if you apply heat to an area that has eczema, you are going to cause more growth of the eczema. Okay, it will outgrow to other areas where there wasn't the condition. The fourth one is tumors. If we apply heat to a tumor, there is going to be growth of abnormal cells. A lot of cells are going to be growing as well, which will increase the size of the tumor, and we don't want it to happen that way. The fifth one is fever or acute febrile illness. You know, the fever causes you to have hot body. And so if you go ahead using heat, what are you implying? It means you are going to cause more heat. Yes, so we don't have to use heating modalities such as infrared when the person is having fever. We don't have to apply direct to either the gonads or the eyes. It is going to affect the person's sperm production, which can make him become infertile. Okay, and in the case of females, you don't have to apply to the pelvis or the lower back when the person is hemorrhaging or is in her menstrual period. The last one is the broken skin. You don't have to apply infrared to a broken skin, because you are going to affect healing, and it can also cause severe bleeding to the patient. So basically, these are contraindications you need to note whenever you are using infrared radiation. So before I go, I want to urge you to become part of the subscribers. Kindly tap on the subscribe button. Remember, subscribing to a channel is done once. Whenever a video is uploaded and you come back to watch, don't subscribe again, but rather you can like the video, and also remember always to give us your comments, because your comments put us on track. Stay tuned. I'll be back with more, and enjoy the rest of your day. Thank you.